Organization said it is rare for people without symptoms to spread the virus. And a lot of folks in the medical community responded by saying, well, that's not entirely true. News 3 reporter Anthony Sabella live this morning to help us make sense of all of this. Anthony?
Hey, Blaine, when we spoke with a doctor from Eastern Virginia Medical School here, and he says what the WHO, the World Health Organization, said about asymptomatic carriers was a misstatement. That's how he's characterizing it. Asymptomatic meaning people who don't show those COVID symptoms. Now, this week, a WHO official said it's rare for an asymptomatic carrier to spread the virus to someone else. That set off a lot of alarms in the medical community. We talked with Dr. Edward Oldfield from EVMS. That's the doctor we spoke with. He calls it a misstatement, telling News 3 we just don't know if there is a difference in transmission when it comes to people who show symptoms and people who don't show symptoms. Now, the WHO eventually kind of walked back that statement, but Virginia's health commissioner doesn't want people letting their guard down as the state continues to open up.
My biggest concern is that as we open up, I want people to understand that the virus is still out there. And while we feel it's safe to go out, it doesn't mean that there's no risk.
Now, doctors say COVID carriers could infect other people before they even show symptoms. So that's something that's important to think about. And that's why they say it's so important that you wear masks when you're indoors in public or when you can't social distance, and to make sure that you're always trying to social distance from people. We don't want to infect others if we do have COVID-19. We're live here in Norfolk. Anthony Sabella, News 3.